Hi, I'm Marissa Warning. I'm a student nurse at the University of South Alabama, and today we're going to be performing IV insertion and removal. The first thing that we're going to do is we are going to verify the patient's orders. We see that there is an order for an insert of a saline lock in the AM for a CT scan, and then we would verify the hospital policy, perform hand hygiene, and then we would check the MAR and the patient's wristbands for two identifiers. We see that this is Jaguar Jones, date of birth of 8/25/1963, and he's allergic to penicillin. So the next thing that we're going to do is we're going to explain the procedure to the patient. We're going to gather our supplies, and then we're going to provide the patient with privacy. Then we're going to position our trash can, perform hand hygiene again, and then we're going to don our goggles. The next thing that we're going to do is we're going to position our patient. We're going to make sure that he is either sitting up or in supine position. We're going to raise the bed to a working level. This is not a working height because it's not waist level, but it's what we have for today. And then we would lower a side rail. The next thing that we're going to do is open all of our packaging. And then we're going to begin to prime our tubing. So the first thing we're going to do is we're going to open our alcohol prep pad. And we're going to clean the tubing. Okay. I'm going to dispose of that. And then open our saline. Get rid of the air bubble that's in it. And then we're going to insert it into our lock. And then we're going to prime. Okay, now that it's been primed, we're going to lightly open just a little bit in the cap. And then we're going to move the lock closer to the patient. Make sure that it stays in there. We're going to remove our needle from the packaging and place our tegaderm out. Okay. Then we're going to verify that we are selecting a correct vein. We're going to make sure that we pick the most distal vein. We don't want to pick something closer. And then we're going to also make sure that it's in the non-dominant hand if it's available. And we're also going to check to make sure that it's a large, soft, and spongy vein. We also want to check for venous distension, so we would stroke the vein. We would also provide warmth so that we could have some vasodilation. And then we want the patient to open and close their fists to make sure that the vein is really well to get. Then we're going to apply our tourniquet. And then we're going to apply our clean gloves. And then we're going to clean the site with chlorhexidine. We're going to clean in a circular motion, a vertical motion, and a horizontal motion to provide friction. We would let that dry completely, and then we would not touch the cleaned site. The next thing we're going to do is we're going to begin to insert our needle. Okay. We're going to go in bevel up. I'm going to pull the skin down, making sure not to touch the cleaned area at 10 to 30 degrees. Okay, so we're going to go in until we have blood return. Then we're going to advance our catheter only. Well, we'd advance the needle 1/4 inch, and then we'd advance the catheter push and then pop our tourniquet, and then we would apply pressure 1 1/4 inch from the site and remove our needle and dispose of it in the sharps container. The next thing that we're going to do is we're going to quickly open our lock, apply it, and we're going to temporarily tape it to the patient. Then we're going to aspirate for blood return, and then we would push the saline. We're not going to do that today because this is a pool noodle and it will get all over the table, but we would normally push the saline. And we would dispose of that in the sharps container. We're going to then apply our Tegaderm. Oh, not that way. And then we will apply the sticker with the gauge of the IV, the time that it was given, the date, and my name. I would normally stick that on there. We're not going to do it for right now because it's kind of hard to get off. And then we will remove this temporary tape and apply a new piece of tape to lock it into place. Okay, now that it's in place, we can completely remove our tourniquet. Okay, and then we would gather our supplies and throw them away. I would make sure that the patient's comfortable lowering the bed, raising a side rail. We want to make sure that I remove my clean gloves, perform hand hygiene, and then I want to teach the patient signs and symptoms of infiltration, phlebitis, and inflammation. We also want to make sure that they prevent dislodging the IV. We want to let them know that they should tell us if the fluid stops or if they see any signs of bleeding in the bandage or in the tubing, and we want to let them know to protect their IV. So after positioning the patient, then we can return to the nurse's station to document. We would remove our goggles at that point, and then we would return to the nurse's station to document. We want to document the patient tolerance, the date, the time, the location of the IV, the type, size, the length of it. We want to document the number of attempts and the if there's a fluid amount going. This has a saline lock on it. So that's all we would document. And then today we're going to be performing the removal as well. So I would come back in and replace my goggles. We're going to put on clean gloves. Okay. And we're going to remove the Tegaderm towards the incision site. Okay. And dispose of it into the garbage can. I'm gonna use my 2x2 right here, and I'm gonna remove this tape, dispose of it into the garbage can, and then I would remove the catheter parallel to the skin. I want to note the intactness of the catheter and then dispose of it. And then we want to hold pressure for 30 seconds. And then we would apply tape. To the bandage, well, to the gauze. And then I would remove my gloves to the garbage can, my goggles, and perform hand hygiene. And then I want to, we would document the intactness of the catheter. We want to note any redness, pain, tenderness in the area. We also want to note any swelling or drainage or, I think that's it, or any tenderness or anything like that. And that completes my insertion and removal video.